Good day, everyone. I am Nina Maika Kaliwat from the group of Classical Learning Theory. So first, let us talk about what is classical learning theory. The classical learning theory is based on the assumption that learning developed is through the interaction with the environment. Additionally, the environment shapes the behavior and the internal mental state such as thoughts, feelings, and emotions. So classical conditioning is comprised of 4 elements. So the first element is unconditioned stimulus, which invariably causes the react in a way. Second, unconditioned response is the response to unconditioned stimulus. Third, conditioned stimulus, the object that does not bring about the desired response. And lastly, the fourth, conditioned response of a particular behavior that an organism learns to produce when the conditioned stimulus is presented. Now, you may be wondering who created such wonderful theory. It was Ivan Pavlov. He developed an experiment testing. The concept of condition reflects Pavlov's dog experiment play a critical role in discovery of one of the most important concepts of psychology, classical conditioning, sometimes called Pavlovian conditioning.
Now, let us move on to the importance of classical learning theory in your role as a health educator. In the clinical settings, it entails making connection between an external stimulus and a naturally occurring stimulus. Classical conditioning theory is an important role in our health educator, since it aids in the determination of behavior in both animals and humans. Additionally, classical conditioning theory is important in our position as a health educator. In clinical settings, since it is employed in both understanding and treating phobias. A phobia is a fear of something specific, such as an object or circumstance, that is excessive and unreasonable. Anxiety disorder and phobias are frequently treated using exposure therapy. The individual is exposed to what they are afraid of. They become conditioned to not be afraid it over time. Aversion therapy seeks it to replace a pleasant response with a negative response in order to cease a detrimental behavior. For example, if a person has a panic attack in a specific location, such as an elevator, he or she may begin to link elevators with terror and avoid fear all elevator journeys. A negative input can influence his or her response. Classical conditioning can help someone unlearn a fear if they are repeatedly exposed to the object or scenario they dread without a negative effect. The underlying idea behind this technique is classical conditioning, often known as associative learning principles. The goal is to replace fear and anxiety with a state of calmness in order to overcome a phobia. Behavioral therapists also employ classical conditioning techniques to assist patients in changing bad behaviors. These therapies are based on the idea that we learn from our surroundings.